Aminat Medical Monologue, empowering healthier lives through trusted medical education. So, a young man in his 20s walked into the clinic because it burned every time he urinated. At first, he thought it was just urinary tract infection and decided to ignore it. And a few weeks later, the pain became worse. And he noticed a thick discharge. Diagnosis, please. Gonorrhea. But here's the scary part. Not everyone with gonorrhea has symptoms. So some people carry the infection for weeks, even months without realizing it, unknowingly passing it to others. Could you have gonorrhea without knowing it? So let's talk about it. Okay, let's talk about it. So welcome back to my channel. I'm Dr. Aminat, and this is a trusted home for evidence-based medical education, where we simplify medicine and empower healthier lives. So every week we break down common medical conditions, separate myths from facts, and help you make informed decisions about your health. So if you're passionate about learning how to protect yourself and your loved ones, don't forget to subscribe and turn on the notification. Now, let's talk about gonorrhea. One of the most common sexually transmitted infections worldwide, and one that is becoming increasingly difficult to treat. And I will tell you why soon. Stay tuned in the video. So what is gonorrhea? So imagine inviting someone into your home, and instead of them helping, they quietly damage your plumbing. That's exactly what gonorrhea does. Gonorrhea is a bacterial sexually transmitted infection caused by a bacterium called Neisseria gonorrhea. Long name. It commonly infects the urethra, the cervix, rectum, the throat, and sometimes the eyes. Just like chlamydia. That's why I always tell you, gonorrhea is the sister of chlamydia. And many people literally don't know that they have it. So why should you care? Here's something many people don't know. Over the years, gonorrhea has become harder to treat because some strains have developed resistance to antibiotics. Sad truth. And that means prevention and early diagnosis are more important than ever. And that's why it's good to go for regular testing. And ignoring it doesn't make it like disappear. It only gives it more time to damage your health. So please, take heed. Go get tested today. Okay, so how is gonorrhea spread? Gonorrhea is spread through vaginal sex, anal sex, sexual oral sex, and also from an infected mother to a baby during childbirth. It does not spread through organ, shaking of hands like people think, by sharing toilets. No, you can't get gonorrhea that way. Sharing food or drinks, or like using the swimming pool that an infected person is. No, so let's don't make myths replace the facts. Let me now put you through to the facts about gonorrhea. Now, who is at risk? Anyone who is sexually active can get gonorrhea. Be the truth. Your risk increases if you have a new sexual partner, have multiple sexual partners, have unprotected sex, have another STI like chlamydia, have a partner who has gonorrhea. So all of this can increase your risk of actually having gonorrhea. Then, what are the signs and symptoms of gonorrhea? Even though most times they don't show, but one of the biggest mistakes that people make is waiting for symptoms. You don't need to wait for symptoms before you get tested. Okay? Because many people don't have any symptoms. And the only way you can get diagnosed for sure is by testing. But if symptoms do appear, I will break it down to male and female, like I've always said, because we all have different reproductive organs. In women, you may notice increased vaginal discharge, pain or burning while urinating. You can have pelvic pain and bleeding between periods. Bleeding between periods. If you want more information about all of this, write down in the description, in the comment section, and I would talk about it. For men, You may notice a thick, white, yellow, or greenish discharge from the penis, which is it's actually unusual, and burning while urinating, pain or swelling in one testicle. Rectal infections may cause pain, discharge, and bleeding, but that's very discomforting in that area. And you could also have throat infection. Sometimes the symptoms don't show in throat infection, but you can get like sore throat. You can get sore throat. So not every sore throat is not just a common cold and just common strep and then you just let it go. Go get tested if you see that it's getting worse. Now let's separate the myths from the facts so that we don't get confused. One misconception that people have is that gonorrhea affects only people with many sexual partners. No. In fact, is that anyone who is sexually active can become infected. So not just people with a lot of sexual partners. That only increases the risk. Another myth is if my symptoms disappear, the infection is gone without treatment. No, the bacteria may still be present and continue causing damage, and that's why you need to get treated and tested again after your treatment to make sure that it's gone completely. Another myth is you can tell someone has gonorrhea just by looking at them. Another false. Absolutely not. Many infected people look perfectly healthy and you cannot even detect it at all. So that is why it's good to get tested and diagnosed by a doctor. So how is gonorrhea diagnosed? I know you all have been waiting for this. And the thing is that testing is quick and simple. It's quite quick and simple, and that can save you a lot of future health damage. And the healthcare provider usually use a urine sample, a swab from the infected area, depending on where the infection may be. And don't just go to a chemist. Don't just go to a pharmacist. Please go to your primary care doctor or a laboratory. And the earlier it's diagnosed, the easier it is to treat, because like I said earlier, treatment of gonorrhea is getting more resistant. Okay, now let's go to treatment. The good news is that gonorrhea is treatable. Okay, gonorrhea is treatable and you should seek treatment. And treatment involves antibiotics prescribed according to the latest medical guidelines, because antibiotic resistance has changed how gonorrhea is managed. Because it takes people long to discover it, or they use a medication and then they stop and then the bacteria gets resistant to that medication. They don't finish their prescription. So please, it is very important to complete treatment exactly as prescribed. Avoid sexual activity until your healthcare provider has advised it's safe to resume after treatment. Make sure your sexual partners are treated and tested. Okay, otherwise reinfection will happen and then you would say, I treated this previously, why is it coming back? It's because you did not treat your sexual partner. So what happens if left untreated? Like, okay, you say, I don't have symptoms, I'm not going to get tested and no need for treatment. I don't feel symptoms anymore. This is where it becomes serious, because in women, untreated gonorrhea can cause pelvic inflammatory disease. It can cause infertility. So why cause damage to your future when you can fix it like right now? It can cause infertility. It can cause chronic pelvic pain. And it can cause ectopic pregnancy. That is pregnancy outside of the uterus. If you want more about that, comment and I will tell you more about that. And in men, it can cause epididymitis, severe pain, and fertility problems in some cases. And in both men and women, it can increase the risk of acquiring HIV or transmitting HIV. So please get tested. And in rare cases, the bacteria can spread to the bloodstream, the joints, and cause a serious condition called disseminated gonococcal infection. And during pregnancy, an infected mother that did not know she had gonorrhea can pass the infection to her baby during delivery, potentially causing severe eye infection, and if not well treated, can cause blindness for the baby. So please, we have to take caution. How can you prevent gonorrhea? Because we are all about prevention. Yes, we talk about treatment, but you need to know how to prevent it too. And the good news is that it is preventable and prevention is possible. You have to use condoms correctly and consistently. Get tested regularly if you're sexually active. If you're not sexually active, still get tested. Talk openly with your partner about STIs testing. Tell your partner so that when you get treated, you already passed it to the partner. If you don't tell the partner about it, they would not know. They would infect you again. And that's like a merry-go-round. Complete treatment if diagnosed. Don't just use part of the treatment and stop. Complete your treatment. Ensure your partner receives treatment too. Very, very important. Okay? And remember that protecting yourself also protects the people that you love. If you really love that person that you say you love, you would protect them too. Stay tuned. If there is one message I want you to remember today, it's this. Gonorrhea is common. It is often silent and it is treatable. But delaying treatment can have lifelong consequences that you don't want. And getting tested isn't something to fear. It's one of the smartest things you can do for your health. Okay? It's one of the smartest things you can do for your health. So please, get tested today. Get treatment today. Treat your partner. And even if you don't have symptoms, please always go for annual checkup. Thank you for watching. If this video taught you something new, please like, subscribe, and share it with someone you care about. And if there's a topic you want me to talk about, leave it in the comment section and I will talk about it. You never know who you might help with this information. And I'm Dr. Aminat. Remember, knowledge saves lives. Prevention protects futures. And I will see you in my next video.